So let's close today with a few final pieces. Many of you have put on conferences and meetings, so you appreciate all of the work that goes into a successful one. I want to thank those whose work behind the scenes has translated this meeting from the drawing board into reality. Julie Harville led the planning and preparations for the annual meeting. Nicole Miller and Stacy Resendez organized the panels, registration, communications, and more. And John Bartkus produced this virtual meeting, smoothly stitching together its many moving parts. Also, in the spirit of continuous improvement, please take a moment to provide feedback on this event using the short survey link in the chat box. Everything that we do in public health and healthcare that moves the needle on equity is important. We can and must push the levers within our reach to improve health equity. Now, I challenge you to become part of a new phase of health equity action. The goal is the same: attainment of the highest level of equity for all people. The objective in this new phase is to help people across the political and ideological spectrum see how programs and policies that improve health equity will help them achieve their goals, how their boats will rise as the tide of health equity rises. We've learned information and tactics from today's panels that we can deploy to broaden support for interventions that improve health equity. We heard from the first panel that we need to break down silos and work together to reduce the costs that are driven by health inequity. We can't just think of it as a healthcare system issue or a business issue or a civic issue. They tie together. We must recognize that the policy lever must be moved to affect some of the structural barriers to health equity. To accomplish that, we must band together. These kinds of changes are attainable. I think about the 33 diverse organizations who joined forces to advocate for the Value and Access Collaborative's joint policy recommendations to make healthcare more accessible to all. We know at least 18 states have turned some of our recommendations into law. What else did we learn from the panel on the economics of health equity? Inequities cost everyone in the community. The way we typically see it is at the individual level. For the patient, it's having to pay for an ER visit due to unstable housing. The costs of health inequity are baked into premiums paid by employers. The system doesn't magically absorb the excess costs. Employers, individuals, and taxpayers have to pay them. Medicare and Medicaid pay big shares of the cost of health inequity, which affects the state and federal taxes every individual pays. The cost of health inequity is not trending towards crisis. We're already in a crisis, so we must act now. And health inequity is not just a moral imperative, it is a business imperative. From the panel on connecting health equity to more Americans' priorities, we learned that it is essential to adapt leadership to the needs of the community and work more at the community level. We again heard about the importance of working across silos, that it is important to bring stakeholders in business, government, education, and nonprofits to the table and agree on what the problem is and then on how to address it. We learned that Mayor Mern uses Move It the Mayor to help establish a common goal and get Findlay businesses, schools, and public health on board with the pursuit of 2 or 3 goals to improve health throughout the community. We also heard about engaging the whole community and that this requires meeting people where they are, understanding their priorities and framing discussions in those terms, which may not be the terms or framing that we use. Many of the people in this virtual convening knew before today that the pursuit of health equity is a moral imperative. I think that with these panels, it may be even more clear that it is an economic imperative as well, and it is urgent. What is the National Forum going to do to help you broaden support for programs, policies, and environmental changes that will improve health equity? First, We are going to continue today's discussions. Throughout the next 12 months, the National Forum will hold many convenings and provide vodcasts that will add to our understanding of how to meet voters and others across the country where they are. Add to our knowledge of how health inequity drives up costs that everyone has to pay, and highlight strategies that are working. Second, we will hold up successful practices that others may adopt and adapt. If you have a success story to share, please let Julie Harville or me know. Third, we will continue to involve you in the Value and Access Collaborative. The organizations working together through this collaborative have achieved measurable impact on policy and healthcare practice. The door is open. If your organization is not already involved, please let Jen Childress or me know that you want to get involved. Today's meeting has been recorded and will be available online. Please watch your inbox for a message with links to the meeting, articles, tools, and other resources, and share them with colleagues who may be interested. And remember that many of the tools and resources already are posted on the website for this meeting. Building public and policymaker support for interventions that improve health equity will take all of us educating people within our spheres of influence and extending our reach. Now, let's take action.